We've had 3 fantastic sessions hearing from our colleagues from the National Disability Insurance Scheme in Australia. And I want to start by thanking Eddie, Sam and Sarah for being so incredibly generous with their time and with their experience and sharing their knowledge. And if it's all right, I just want to wrap up as usual by sharing some of my own reflections on some of what I heard. And I think to start with, for all of us here in England, it's really important to understand how other countries have transformed, or at least are trying to transform. And as Eddie noted in the webinar, Australia is one of the few countries in the world where the system has bitten off the whole problem and tried to find the whole solution. So the learning from the Australian experience seems to me to be pretty critical, especially now as it looks like, you know, there is a real possibility of social care reform, and that is becoming a reality. And so some of the key points of resonance for me were firstly around the narrative. And when Australian colleagues talk about the National Disability Insurance Scheme, they talk about investment repeatedly. And we heard it here again today, didn't we? Both Sam and Sarah spoke about investment in people, investing in people across their lifetime, with an expectation, of course, that there'll be a return on this investment. And I know that many TLAP partners are concerned that we frame our existing narrative, which for far too long has been about social care being a drain on the public purse, to instead seeing it as an investment in people which will pay dividends. And Sarah spoke about the availability of good data that is evidencing the difference that this investment is making, with people reporting improvements in community participation, improvements in people building new relationships, and improvements in health and well-being with fewer people going to hospital. And that's the other key bit of the NDIS, the National Disability Insurance Scheme. As well as investing in people and their well-being, there is a corresponding and significant investment in research and data, which clearly continues to support the case for NDIS, National Disability Insurance Scheme, and also keeps it on track. So there were some other highlights as well that jumped at me listening to Eddie, Sam and Sarah. The significant number of people with a psychosocial disability who were brought into the scheme and now have a personal budget as a result of that, something I know we're really concerned to see more of here in England. And Sarah's comment too about the robust predictive modelling they have, which help keeps a check on the sustainability of the scheme, enabling it to make sensible shifts when it looks like some of those costs might be increasing, including moving to a light touch review every year, or if everything seems to be going well, just extending the plan, extending the funding. And it was no surprise at all that Sarah reports that participants are really happy with that, because when I think of the conversations I've had with colleagues with lived experience, they've spoken so much about their nervousness, their heightened anxiety when it comes to that annual review, particularly in terms of what it means for their personal budget, and more appropriately, I guess, a reduction in that budget. So it seems to me that there is so much we can and should take from everything we've heard today, and of course the other 2 sessions as well, on so many different levels: the economic arguments, the evidence, the investment in data and research, but more importantly, the investment in people. So once again, I want to thank Eddie Bartnick for pulling all of this together, and thank you, Eddie, for giving us access to these outstanding leaders who have designed, created and continue to work to ensure the success of the National Disability Insurance Scheme, including today, of course, Sam Bennett and Sarah Johnson. So from the TLAP partners to our Australian colleagues, thank you all. I genuinely hope we can learn from your experience to form our own approach to social care and build a better and brighter social care. Thank you.